I'm now glad to see this report. I have to say that I'm not completely convinced that the same issue couldn't arise again as a result of this, and I look for reassurance on that. The fact is that a large, commercially forceful partnership of 71 doctors exercised a break clause in their lease on the premises in which they were contracted to deliver NHS services without the permission of the CCG. And they did so in a time span where it would have been impossible to have built a new surgery, to have acquired a premises, gone through the design phase, got planning permission and built it. Now that implies to me that there was a clear intention to force the CCG's hand. And I think that's morally indefensible, frankly. In response to that, I would have assumed that reviewing the contractual terms and conditions which apply in such cases, you would consider putting in a penalty clause which says if you surrender the lease on the premises in which you are contracted to deliver NHS services without our permission, there is an automatic multi-thousand-pound penalty clause, end of. And I'd like your response to that. And also, can I just ask, as merely a matter of interest, it says the paper was shared with the CCG's internal auditors. I wonder why that was and what their comments and observations were, just as a matter of interest. Nothing. Thank you.
Thank you, Councillor Cleaver. In response, I think the work of the Estates Group and some of the systems that the CCG are putting in place, I think will mitigate the risk of this happening in future. I don't think it's always possible. It's impossible. I don't think it'd be possible to put in a completely foolproof system. There may be some issues that we can't foresee, but I think the systems we're putting in place are a good approach to managing this and really do mitigate any risk of practice serving notice about the CCG's knowledge in future. I think purely having the database in place where we can keep, we can track all leases, break clauses, etc. And the fact that we're engaging more closely with primary care across the patch due to the new primary care team setup, I think will mitigate a lot of the risk around that as well. Just to pick up the point around penalty clauses, the contract that practices or primary care providers have is set nationally, so that's something that we're given. We can't alter that or change that. But certainly I think the CCG wants to take a robust but proportionate approach to contract management, and certainly will be, as learned a lesson, I think, from the experience with Lakeside, ensuring that practices are very clear about the CCG's approach and that we're clear that any moves to end provision at an existing site would be breach of contract. And again, that's something that we were, as soon as we were aware of the position with Lakeside, we were very clear with them on. So I think that's the other answer to the other question. I think the final point you were asking about was the internal auditors and their view. We were guided by a primary care commissioning committee just to talk to PricewaterhouseCoopers because of their expertise around internal audits and carrying out similar kinds of reviews. So they provided really just sort of guidance and a steer on the areas we should focus on, and also the how we presented the actions, or how we considered the actions that needed to be taken. Those presented those back to PC3. So it's very much a kind of an advisory capacity, and they didn't get involved in the content, but really sort of structure of the report and making sure that we picked out the key issues from the sequence of events. Again, I don't have the detail to hand again in terms of the feedback they provided, but it was very much around structure and how the lessons learned were presented back to PC3.
Thank you for that. In terms of what you said about the CCG's improving the way it reviews quality in the primary care sector, I welcome that, and I hope that we'll be able as a committee to take that on board and review that at the same time as we review the next CQC inspection report for Lakeside, which I gather is in our programme of work. Thank you.